30 million Americans suffer from sinus problems, but surgery can often be risky and painful.
A new procedure has sinus sufferers breathing a sigh of relief. 7's on call with Dr. Jay Adlersberg. Jay?
Shade, Diana, sinus surgery can have a long, uncomfortable recovery, and there can be some bleeding for the first couple of days afterward. Now some surgeons are trying a new procedure that does away with much of the discomfort and the long recovery. Little comes between Gary and his golf. He's got his 250-yard drive back in play.
That's a good one.
But for a while, severe headaches and trouble with balance drove him away.
Every day. I couldn't smell. I couldn't breathe through my nose very well. I couldn't taste food.
Now there's new hope for sinus sufferers, illuminated balloon sinuplasty.
It's kind of like, balloon angioplasty like they were doing for the heart.
A guide wire with a fiber optic cable leads the way, lighting up the sinuses for doctors. A tiny catheter with a balloon on the end follows it. When the balloon is in the right place, it's inflated, expanding the sinus opening.
You're actually moving the bone slightly. And studies have shown that it stays in that position. It doesn't regrow back and close off the sinus.
The balloon is removed and the patient goes home the same day.
The opening is enlarged and restores it to normal health.
This procedure produces the same results as traditional surgery, but it would reshape the sinus with less tissue trauma, no incision, little bleeding, and faster recovery. Just a few weeks after surgery, Gary is breathing easier. He can smell and taste again.
My head doesn't hurt so blasted bad, so I can focus. It feels like I'm just one person instead of like 7, which is a good thing.
A good thing that's got Gary back into the swing of things.
Oh, that's better.
This is not an appropriate technique for all patients with sinus problems. It's good for patients who don't respond to antibiotics for chronic sinus infections. It only takes about 15 minutes to perform in the operating room, and it outweighs the risks of traditional surgery.